All right, so how do we get infected? That's the question. The process of infection and disease is what I'm going to talk about in this topic. So when we're talking about infection, we're talking about a relationship between microbes and the host. And we have host defenses, and microbes may have virulence factors. And so this is a back and forth between host defenses and virulence factors, and it's a balance. And so if the balance is tipped in the microbe's favor, we may end up with infection and disease. And so when we're talking about those things, we do need to have a common language, okay? So what can cause disease when the host defenses are compromised, or when they become established as part of the body, so in the wrong site from which they are not normal flora? Those are called opportunistic pathogens. Opportunistic pathogens, okay? So if that's an opportunistic pathogen, then who's capable of causing disease even in a healthy individual? True pathogens, right? True pathogens. All right, and so what is their, it's inexactly called pathogenicity. Pathogenicity is not really a word. What is the measure of just how nasty these bugs are, the relative severity of disease? Virulence, right? And that's determined by their ability to enter a host and cause damage, right? So opportunistic pathogens are only there when the host is immunocompromised or established in the wrong site. True pathogens can cause disease even in a healthy individual with normal host defenses. And true pathogens, the severity and how well they are able to enter a host and cause damage is their virulence. And what do they have? What is that characteristic or structure that gives them that ability to enter and cause damage? Virulence factors. Virulence factors. So true pathogens have virulence factors. Now when we're talking about pathogens, classes of pathogenicity, so virulence, right? It's characterized or described by the CDC in 4 levels, with 1 being low and 4 being to high, right? And our lab, which is full of opportunistic pathogens, would be a biosafety level 2, right? 2. Okay, so this is your roadmap, all right? We're going to talk about the process of infection and disease. And so to cause an infection, to suddenly become a pathogen, a microbe must do these things, okay? And I'm going to use this as our roadmap as we go through the next several slides. So if you don't get it written down right now, you're going to see it again and again as we build. All right, I keep saying infection and disease, but let's make sure that we have those particular terms sussed out, because that's a difference and we can't use them interchangeably. Infection is the colonization of sterile body tissues by a microbe, okay? Colonization of sterile body tissues. Whereas the disease is the disruption or deviation from a normal healthy state, from homeostasis. Okay, so that's the effect, that's the damage, but the infection is the colonization of sterile tissues. And you can have infectious diseases, that's what we're talking about here, but remember, you can also have non-infectious diseases, right? Like diabetes or Alzheimer's. Those are not caused by the colonization of a microbe. So really when we're talking about infection and disease in these slides, we're talking about infectious disease. Okay, process of infection. What's the first thing we need? We need a way in, right? And that's called the portal of entry. That's how the pathogen is going to enter the body tissue. And remember, if it comes from outside the body, that's an exogenous infection. And if it comes from inside the body, that's considered a endogenous infection. Yeah. Now, the portal of entry is going to be same places that have resident flora, right? So it's going to be places like your mouth, your intestines, your skin, right? Because they have to make their way into sterile tissue from that portal. So now most pathogens are adapted to pass host defenses for a specific portal. So most pathogens have virulence factors that are for only a specific portal. So think about, how do you get sick from E. coli, right? Versus how do you get sick from the cold virus, right? Most of those are different portals. If an organism can enter from different portals, it will cause different diseases. So for example, Streptococcus pyogenes, it causes strep throat. That's strep throat when it goes through that portal, but if it causes a skin infection, it's called impetigo. And it makes sense. It's a different part of the body, so it would cause different diseases. Most organisms are only have the virulence factors for one particular portal of entry. All right, so speaking of portal of entry, what are some of these? We have the skin, we have the GI tract, we have respiratory tract, we have urogenital, and pregnancy and birth is actually considered a portal of entry because it's going from one human into a new human, and so in that case it is still an entry into that tiny little host, right? Okay, so I don't know why I wrote these slides this way. These are very example heavy, and please remember that I never test on examples, right? So you don't have to know these, just use them as like an enrichment of kind of examples is what they're supposed to be. So skin is a common portal that's usually through nicks, cuts, and abrasions, but the organisms that have virulence factors for this particular portal of entry, they could have digestive enzymes. So they could produce enzymes or toxins that can actually break down your skin. But some organisms can be just injected during a bite, or needle injections through the skin then is also still considered a skin as a portal of entry. So examples would be staph infections, Staphylococcus aureus, strep pyogenes, which I mentioned causes impetigo. There are some organisms that have adaptations for the mucosa, like Haemophilus influenza, which causes pink eye, or Neisseria gonorrhea, which also causes conjunctivitis. Those are the same thing. I don't know why I wrote them differently. And Chlamydia tracheomatis, which can infect the trachea. So those guys are going to have virulence factors that are specialized just for the mucosa, and which is a specific type of skin, right? Okay. Gastrointestinal, this is going to be through things that you eat and drink, but also things that you might put in one end or the other. People usually are snickering at this point, but it's true. And you have to think about some of those things. And so that is a portal of entry for the microbes. It's a way for them to get inside. And so the adaptations or the virulence factors that the organisms might have is going to be their ability to survive digestive enzymes and massive changes in pH, right? Because we have a very acidic GI tract, and we have all these enzymes that are out there to break down compounds. And so that would be a virulence factor, would be how they're going to survive our host defenses. So examples, oh my goodness, Salmonella, Shigella, E. coli. You can get sick from somebody else's E. coli. Vibrio cholera, that's another bacterium, but also polio, hepatitis A, often comes from food, and then Entamoeba histolytica. Do you remember this one? This is our protozoan. It's an amoeba, right? And Giardia lamblia, another protozoan, and it has two flagella, so this guy has a flagellate. This is the one that these two guys are the ones why we would filter our water if we were ever like backpacking or somewhere where we weren't getting city provided water. Okay, next portal of entry is going to be our most common, that's the respiratory tract. And that's because we have this thin mucosa and it's continuous, which allows the exchange of microbes. And very small microorganisms are going to be inhaled much more deeply, so they get way in there. They already got a fast track into the deepest part, the best portal of entry. So that could be considered a virulence factor, right? Just their size, possibly. Examples are going to include Streptococcus pneumoniae, which causes pneumonia, Klebsiella pneumoniae, which is intestinal flora, but for some reason it somehow gets mixed up in this respiratory tract, Mycoplasma. I want you to think about this. I told you about this a couple of times. What do you know about mycoplasmas? They're not acid fast. That's the Mycobacterium tuberculosis. That's the next one down. Mycoplasma, emphasis on the plasma. They have no cell envelope. They're the ones that are only a cell wall, or I'm sorry, only a cell membrane with sterols in it. They're pleomorphic and they're extremely tiny. They're the ones that cause atypical or walking pneumonia. And then you've got your viruses, right, which are the tiniest of them all: influenza, measles, mumps, rubella, chickenpox, cold virus, which is the rhinovirus, and histoplasma. Histoplasma, one of you has this as your eukaryote. This is a yeast. And this yeast actually often parasitizes people with AIDS. This is a respiratory fungal infection, which is incredibly hard to diagnose and treat. It's also pleomorphic. All right, urogenital, also called urethroterrorist incidents, right? But these can also be sexually transmitted infections. They're going to enter through the mucosa of the genitals. It could be either unbroken or abrading, depending on the organism, meaning depending on what virulence factors they have. If they're very virulent, they can get right through unbroken mucosa, but if they're less virulent, they might need some abrasions. Some of these organisms are going to be our endogenous misplaced organisms from the GI causing UTIs. Examples would be Neisseria gonorrhea, herpes, HIV, hepatitis B, Trichomonas. Do you remember Trichomonas? It's also a protozoan. It's the one that didn't form cysts because it is a sexually transmitted organism. So it goes from person to person. And Candida albicans, this one would be a low virulent organism because he's resident flora, but can cause yeast infections if given the opportunity. All right, pregnancy and birth. So remember, this is going to be from mother to child or something happening during birth. So some organisms can cross the placenta, the umbilical cord, and they can spread through the fetal circulation. So it can go from mom to infant. They can enter mom through the mucosa of the genitals, and they can have massive effects. From abnormalities or damage all the way to stillbirths or abortions. Think about Zika, right? This is a one that is relatively recent that can go from mother to infant and cause all kinds of abnormalities. But also group B, strep, that's that beta hemolytic, weakly beta hemolytic Streptococcus agalactiae down here at the bottom. It's often included in what's called the Storch test or the Torches test or the Torch test. It depends on what the hospital calls it, but it's this kind of rapid fire testing for anything that mom might have that could cross into the fetus. And it often includes things like syphilis, which is Treponema pallidum, toxoplasmosis. Do you remember Toxoplasma gondii, that protozoan that was found in cat feces? Why moms aren't supposed to change the litter box or get a new cat. And then they also do like other diseases. That's the O in Storches, hepatitis, AIDS, chlamydia. Rubella, which is a virus, and cytomegalovirus as well. Those are all often parts of the Storch or Torches test. Okay, next is infectious dose. So we're talking about portal of entry, but we also have to talk about not only like where and who, but we have to talk about how much, the infectious dose. That's the minimum number of infectious agents, so cells and or cysts or endospores, right? That are required in order for an infection to proceed. So typically, the more virulent an organism is, the more able that organism is to attach and evade host defenses, the fewer numbers we need right? Because our host defenses don't have to wipe out nearly as many of them, or I'm not saying that right. The more virulent the organism, the smaller the infectious dose. Whereas if an organism is less virulent, they're going to need an awful lot because our host defenses are going to be able to wipe out a bunch of them. So think about like organisms that have to go through the GI tract, right? All of those acids and enzymes that are part of our host defenses are going to mean that a organism is going to require a much larger infectious dose. Right? Virulent or not, they usually do. So now, if you have an infectious dose, if you took in more infectious agent than the infectious dose, you're going to get sick really fast, right? Whereas if an organism is only weakly virulent and you take just the infectious dose, you may or may not get sick. But if the infectious dose or how much you took in of the weakly virulent organism is in excess of the infectious dose, it's a threshold number, then you will end up with an infection. If the number is below, like I said, you might not get sick. It also has to do with the virulence. It also has to do with attachment. So attachment is our next step in the process of infection. It is what it is, right? It's how the pathogens are going to attach to the host and gain entry to the body compartments, so to the sterile compartments. So again, this is going to be very specific to the pathogen, right? Their virulence factors, but it's also going to be specific to the host and host cell type. So think about like with viruses especially, that host range and what host receptors we have on the cells. So not just adhesion of viruses, but other organisms, but it's best illustrated with viruses. So bacteria are going to use attachment things, right? We talked about this in biofilms, right? They have fimbriae, slime, capsules. Those are all part of attachment. Whereas if you've got a helminth, what are helminths going to use, right? Hooks, barbs, suckers, right? They're physically going to attach, right? So we're not infected yet, okay? So they've got to find the right place. They've got to attach. And we still have host defenses too. So we have innate host defenses that are going to prevent them from finding the right portal. They're going to prevent them from attaching. And of course, we talked about the virulence factors that they have. Now there's this period where we're going to have secondary host defenses. So now they're starting to get in, and so now we're going to respond to their presence. So we have host defenses for a response. And of course, they're going to have virulence factors to respond to our response. So in order to invade, in order to actually cause an infection, they still have to survive our response host defenses. Things like phagocytes, okay? So phagocytes are white blood cells that engulf or phagocytize microbes. They break them down using enzymes inside our white blood cells and just destroy those microbes. Well, if that's our response, okay, you're here, I'm going to engulf you with a white blood cell and destroy you, they also sometimes have virulence factors that are going to help them evade those host defenses. And those specific ones that have to do with phagocytes are called antiphagocytic factors. So these are virulence factors that prevent them from being phagocytized. So, for example, Streptococcus and Staphylococcus have have enzymes or chemicals, toxins called leukocidins. These are little protein toxins that they secrete that are toxic to white blood cells. So it's basically like if you engulf me, I will destroy you and poison you from within the white blood cell. Some organisms are a little less sophisticated, right? They produce a capsule that makes them too hard to destroy. Too hard to destroy, it makes them hard to detect, it makes them hard to engulf, and it makes them hard to degrade. And some organisms are just not easily digested. Think about Mycobacterium tuberculosis with that mycolic acid in the cell envelope that's very, very waxy. That's going to make them very difficult to degrade. So these are all anti-phagocytic factors. These are all virulence factors that are going to prevent phagocytosis. Right? So there's our white blood cell on our Streptococcus pneumoniae tucked inside its capsule. Okay, so let's just recap. I know I talked fast, but let's see if you got this concept down. All right, a new intestinal pathogen has a high infectious dose. Is this new pathogen more or less dangerous than Shigella, because Shigella has a very low infectious dose? It's going to be less dangerous, right? So think about it this way. Shigella's infectious dose is somewhere between 8 and 10 cells, which is terrifying. 8 and 10 cells, and you will get a Shigella infection. Whereas this organism has a high infectious dose, which means you could put 8 and 10 cells on your salad and eat it, and it wouldn't be a problem. You would have to have, say, 100 or 800 and 1,000 cells in order to get sick. So it's less virulent, it's less dangerous. All right, damage. They're in. They made it. We are now starting to proceed with infection. They have reached the portal of entry. They have attached. They have evaded host defenses. Now they're causing damage and disease. So now we're going to talk about virulence factors that cause damage. We talked about virulence factors that help them gain access, attach, evade host defenses. Now these are the real nasty virulence factors. These are the ones that just disrupt homeostasis, disrupt the normal state, and cause disease. So there can be direct damage. So these organisms can secrete exoenzymes or exotoxins. Toxins are protein too, but they're not enzymes. They're just proteins that cause damage. So let's talk about some of these things. So exoenzymes, virulence factors that they might secrete. These things could be mucinase. All of these are going to end in ase, and almost all of them, the first name tells you what they do. And in this case, I say these are examples, but you should know what these are, especially since they're two-part words that you can put together. So ACE is the enzyme, mucin, right? So this guy disrupts the mucosa. This is an enzyme that breaks down the mucosa. That's also why amoebic dysentery is just such nasty diarrhea, because it's actually destroying the mucus of your intestines. So you're kind of like leaking from within and dissolving. Yeah, it gets gross. All right, so here's another one, keratinase, right? So ACE, it breaks down keratin, right? Keratin is a protein that's in skin and hair, and it's secreted by the fungus that causes ringworm. So that's part of how that guy not only establishes himself, but then also causes us a lot of problems. The next one is collagenase. What do you suppose collagenase does? Surprise, surprise, it degrades collagen. Collagen is that connective tissue of our skin. And so this is going to be lots of organisms like Clostridia and certain worms, right? Remember we learned about the larvae of hookworms that can burrow into your skin and then make their way through the bloodstream into whatever their component is, or their body compartment is. It's usually the intestines. Next one's hyaluronidase. Now, if you've paid attention to the super fancy, expensive night creams that are supposed to prevent wrinkles, they often say, now with hyaluronic acid. And that's because hyaluronic acid is a substance that cements our cells together, and so it's associated with healthy, youthful skin. And so if this organism has hyaluronic hyaluronidase, it's an enzyme that's going to break that apart. It's actually going to be able to break apart the mortar between our cells and work their way in. So think about staph, which causes staph infections, and some of these other guys which can invade through that portal. Next one's coagulase. Coagulase causes clotting of blood or plasma. So this guy uses this particular enzyme to form a fibrin clot around the bacterium, and that's going to protect the bacterium from host defenses, because you're coating yourself with the host proteins, the fibrin proteins, and so you're in a little cocoon in there, nice and safe. But as a host, we definitely wouldn't want our blood to just like randomly start clotting, especially around microbes. So that's a really nasty virulence factor. And then there's also kinases. Kinase is a general term. You can have kinases produced by streptococci or staphylococci, but these guys are going to do the opposite. They're going to dissolve fibrin clots. So we make these fibrin clots so that we have scabs, right? So our blood clots if we're bleeding, and if that is a weakness in our tissue, these guys can make their way in by just dissolving that clot with these kinases. So we can actually test these virulence factors in lab. In the lab that I wrote, we used to do this. Using an immunoassay, but the old school way would be to take a rabbit plasma in a tube and inoculate it with a bacterium, and if it clotted, they had coagulase, and if it did not clot, they were coag negative. And this was a really nice way for us to determine if you had a staph infection that was caused by Staph aureus, or it was just Staphylococcus that is benign resident flora like Staph epidermidis. So you can see the two different types of clots on the plasma, and then the non-clotted plasma. Okay, more terms. So we talked about exoenzymes. Now these are going to be exotoxins, right? So if I'm talking about any chemical product that an animal produces that's poisonous, that's going to be a toxin, right? And if they can produce a toxin, what's the gen, right? Toxigenicity, right? The effect of toxins is called the toxinosis. If it's spread by the blood, it's called toxemia. And you know this. If you're out drinking and you are ingesting toxins, you might become intoxicated, right? So these are intoxicants. If they're secreted, they're exotoxins. And if they're released only when the cell is damaged, that's called endotoxin. And what's the only endotoxin? There's only one. Gram-negatives have it. Don't mind dump, I know you know these. It's all coming back. Lipopolysaccharides are endotoxin. So we only have one lipopolysaccharide endotoxin, but there's many exotoxins, and I just gave you a whole example of exotoxins, or exoenzymes. Let's talk about exotoxins. So hemolysin is an exotoxin. There's two types of hemolysin, ones that can break red blood cells completely, which would be beta hemolysis, which is one characterized over here by the beta. It's got a yellow halo around it because all the red blood cells around that organism have been completely lysed, whereas alpha hemolysis is just damaging the blood. It's kind of a bruisey, greenish color. It's a different type of exotoxin. They're both hemolytic, right? They both lyse red blood cells, but one lyses completely and one lyses incompletely. And then that little V down at the bottom, that's supposed to look like a Greek letter gamma, because instead of saying non-hemolytic, for some reason microbiologists decided that they had to call that gamma hemolysis, meaning non-hemolytic. And you'll notice with the gamma hemolytic organism, Just because they're growing on the blood, they're still creating toxic products. We flush our toxic products, but theirs go into the blood, and so that is going to still kind of damage the blood a little bit, but that's not lysis. The only lysis is this beta and the alpha. And notice the alpha's got this extra little drip on my plate here. That's because it's the organism Streptococcus pneumoniae, which is pictured in the middle here. Streptococcus pneumoniae produces a capsule, remember that cartoon? Well, the capsule is very mucoid, and so on this slide, I held up the plate before I incubated it or slightly after, and then incubated it again, and some of that mucus ran down, and so the toxins started destroying the blood in a new spot. We also have Streptococcus pyogenes on top here. That's beta hemolytic. That's the one that causes strep throat. So you can imagine that's doing that in the back of your throat, right? So no wonder it's so painful if it's doing that. And then remember the group B strep, the one that's part of the Torches test. That group B strep is the Streptococcus agalactiae here at the bottom. That's a weakly beta hemolytic organism, but notice it still has that golden halo, which means it is doing complete lysis of the red blood cells. It just hasn't destroyed all of them like this pyogenes has just yet, but it will. Give it time. There are also toxins called A and B toxins. Now these are toxins, these are two-part protein toxins. So they're proteins, but they're not enzymes. And they're two parts. There's part A and part B. Surprise, surprise. And so the way I liken this is to two girls. They are going to the club, okay? And part B, girl B, binds to the receptor molecule of the host cell membrane. Okay, well, so if they went to the club, girl B talks to the bouncer, and she sweet talks the bouncer and gets the bouncer to let both of them in. So when B gets brought in, the protein part B also comes in with it. So the two proteins make their way into the cell, and then what happens is they separate. And A starts to cause damage within the cell. So for example, these two girls, they went into the club, part B, sweet talks the bouncer, and then they separate, and A gets drunk and wrecks up the place. Okay. So why do we care about these toxins? Clostridia species are really good examples of A and B toxin producers. And these toxins often disrupt some sort of action inside the cell. So for example, tetani blocks the action of spinal neurons. So Clostridium tetani causes tetanus. You may have heard of lockjaw, right? So if it's blocking these neurons from communicating, it's disrupting that message that says release, move, and that's why you end up with lockjaw. Whereas on the flip side, Clostridium botulism prevents the transmission of nerve muscle stimuli, and so a lot of times you'll see like floppy baby syndrome, and that's because the baby has botulism and the nerve muscle stimuli have been disrupted, and so the baby just can't move. It's just floppy. And then we also have pertussis, which is Bordetella pertussis. It's another gram-positive bacterium, I believe. But pertussis inactivates the respiratory cilia, so the little microvilli that are constantly raking things up and out of your lungs so that you cough out dust and other crap that you've breathed in. The pertussis inactivates that, so now they're not doing the constant cleaning, and so this is also why coughing with pertussis is ineffective, and pertussis is often called whooping cough because that cough is so ineffective, and that's because of A and B toxins. So you should definitely know what A and B toxins are and how they work. All right, so those were two examples of exotoxins. There are so many exotoxins, right? But hemolysin is a specific one, and A and B toxins is a group. Endotoxin, there is only one, right? There is only one, and that's the lipopolysaccharides that are part of the outer membrane of gram-negative cells, okay? And those, remember, they cause endotoxic shock if they are released in high enough numbers. meaning that you could have massive changes in blood pressure, diarrhea, vomiting, fever, all kinds of nasty things just because of this one endotoxin. But that toxin, we have all kinds of gram-negative microbes in our intestines, right? E. coli is gram-negative, and so is Klebsiella pneumoniae. And so they're going to be lysing, like they're going to be dying because that's just part of life, right? We know even stationary phase organisms are still dividing and dying. And so the effect of the endotoxin, fortunately, is dependent on the amount. And this is going to come back into play when we start talking about antibiotics, because if you remember when we did the web quest about Hillary's pneumonia, and I said that there are some antibiotics that are bacteriostatic, which just kind of pause them and prevent them from replicating, and then there are ones that bactericidal, which are just going to outright kill them. You might not want to take a bactericidal antibiotic for a gram-negative infection, right? You might want to just pause them with a static antibiotic. That way they can kind of die in smaller numbers, or your phagocytes can kind of engulf that infection and degrade them in a different way that would not release this endotoxin. Because if you lyse them all at once, you are at risk for endotoxic shock, right? All right, so you need to know this, right? But you do already know this, okay? I'm going to fill in some of the parts here. You've got exotoxins and endotoxins, right? And so exotoxins are toxic in what doses? Whereas endotoxins are dose dependent, right? Only in large doses. So exotoxins would be only toxic or are toxic in very small doses, right? Let's skip the effects. Although the effect of endotoxins could be systematic, right? It's an endotoxic shock. What's the effect of an exotoxin? I guess we'd do it. It's very specific, right? So very specific cells, right? Red blood cells only, or only the certain types of cells for an A and B toxin, for example. Oops. And then chemical composition. Endotoxins are lipopolysaccharides. What are exotoxins? Well, if they denature at 60 degrees centigrade, denature can only be a protein, right? They're proteins. They're not enzymes, but they are proteins. Does endotoxic shock produce fever? Yes. Does exotoxins produce fever? Not usually, right? And produced by gram-positive or gram-negative. Endotoxins, right? Gram-negative only, whereas exotoxins could be anybody, right? Anybody could produce a gram or a exotoxin. It's just very broad category. All right, more disease, necrosis. You know what necrosis is? Death, right? Cell death, right? Necrosis. So think about when the organisms are established, they are colonizing sterile tissue. Just the fact of them being there could weaken the tissue. But also think about if they're blocking things like ducts and vials and tubes, that's going to cause problems. So we're talking about damage just by their very existence now. We're not even talking about damage based on toxins or exoenzymes. We're talking about they're just there where they don't belong. And this accumulation of damage can lead to cell death, which is called necrosis. So we've got portal of entry, attachment, survive or evade host defenses, and damage and disease. But it gets even better because organisms aren't the only ones that can cause damage and disease. And I think at the 40-minute mark here, I'm going to put a pin in this and I'll start a new video from the second part of this.